Hello, everyone. Myself is Prakash Biradar, Assistant Professor in the Department of Pharmacology and Toxicology, KL College of Pharmacy, Belgavi. So today we are learning about the basic principles of chemotherapeutic agents. Okay. So what is the chemotherapy? So my presentation, that is the learning object, introductions, history of chemotherapy, principle and the antimicrobial therapy, and classification of antimicrobials and antimicrobial toxicity, and along with that we are studying about the antimicrobial resistance. Okay, so chemotherapeutic means a chemical component may be derived from the chemical entity or the substance derived from microbial, which is attenuated and with selective toxicity against the infectious agents like virus, bacteria, protozoa, fungal, helminthes, and also even the abnormal cell growth, that is the cancerous cells also, it will be covered, and which is having a minimal side effect for the host cells. So such study we can call as a chemotherapeutic. Okay, so these are the this one different class of component in the chemotherapeutics, that is the antibiotics and also antimicrobials. Antibiotics are the substance produced by the microbial and which are selective suppress the growth, or they will kill, or they can be inhibited their growth also. So at a very low concentrations of these agents. So such agents we call as a antibiotics, whereas the antimicrobials, any substance of the natural or a synthetic or a semi-synthetic origin at which the lower concentrations which can kill or inhibit the growth of the microbial and have a less side effect over the host cell without damaging to the host cells. So such an agent we call as a antimicrobials. So in the 20th century, the physicians were overjoyed about the discovery of these antimicrobial agents, because this is one of the power drug on the diseases, all the kind of the infectious diseases that can be used for this antimicrobial agents. So especially at that time in the World War II, there are many wounds soldiers were suffering. At that time, they used to give the chemotherapeutic agents, and also there are deadliest diseases like plague and other things. At that time, there was no drugs. So in the 20th century of the discovery of these antimicrobial, so this is one of the few drugs which can cure, and not just for the palliate diseases. So this type of therapy is generally called as a chemotherapeutic agents. Okay, they are acting over the treatment for the systemic infections with selective drug that selectively suppresses the infection microbials and without affecting or significantly not affecting the host cells. So coming to the history of the chemotherapeutic agents, it is a big evolution of the genesis of the chemotherapeutic agents were started in the early of the 19th century or in the 20th century. In 1908, discovered by the Paul Ehrlich. He is said to be an father of chemotherapeutic. Okay, he discovered the one of the antimicrobial agents, that's amines, and he has also discovered the animal model for the study of these chemotherapeutic agents. And after that, we are knowing that discovery of the penicillins by the Alexander Flemings in 1928, and in 1932 Prontosil was the first antimicrobial agent. Bayer's pharmaceutical was released into the market, and after that in 43 nitromustards were used for the anti-cancers, and in 44 there was a discovery for the streptomycin, which can also be used for the one of the first line therapy for the anti-tuberculosis, and so forth. In 1951, thiopurines, and 57, 5-fluorouracil, which can be used for the anti-cancers, and also in 58, methotrexate, and in 59, anti-tumor antibiotics. So 1950 to 60, it is said to be a golden era for the antimicrobials agents, and 53, Vinca alkaloids. All these drugs were meant for the anti-neoplastic or anti-cancer actions. And after that, in 62, nalidic acid, which is used for the UTI and one of the safest drug for the during the pregnancy. And after that, there is monoclonal antibiotics in 96. It will be there. Imitinib is one of the monoclonal antibiotic, and so forth. After that, there will be target specific chemotherapeutic agents discovered. So this is what the history of evolutions. So in 1943 to 60, it is called as the golden era. So many antibiotics along with the anti-cancer drugs were discovered. So in this way, this is about the brief about the history about the antimicrobials. Now moving towards what are the principles of antimicrobial therapy or rational use of the antimicrobial, because this is very carefully we have to handle, especially the physicians, because one of the resistance it will be causing by the so many microbials, which is said to be that is the superbug formation will be taking place, which is resistance to all the antimicrobial. So that is what the principle for the antimicrobial therapy is required. So this is what about a brief overview about the antimicrobials. So they are antibiotics. They will be acting over the bacteria. They will be acting over the fungi and also antiparasites and also antiviral. Even the COVID-19 and HIV, they can be treated by using this antimicrobials. Okay. So the principle of the antimicrobial therapy, it will be solely based upon the diagnosis, the site of the infections, and also the responsibility of the microbials, which are sensitive towards the antimicrobial drugs. So culture test can be done, and after that they can be prescribed, which is having a more zone of inhibitions. And they will be decided the chemotherapy is necessary, so that usually what happens, acute infections, they require the chemotherapy. But if it is a chronic or if there is any wound or he is having a pus and other things, so because of they are having an inefficiency, because there will be of more folic acid and other drug synthesis will be more there in the pus and other cells. So because of that, they will becoming an ineffective also. But in surgery, there will be a requirement of the antimicrobial to flare up of the certain infections, and selection of the chemotherapeutic agent. It will be very specificity will be there. So depending upon the spectrum of actions, that is the gram positive, gram negative, and anaerobies, or even the atypical for that. So if the wider in the spectrum, they are preferred, but it can also be selected depending upon the pharmacokinetic factors like physicochemical properties of the drugs, and also related to the patient-related factors, because certain individuals, they will undergo the certain allergic, or if they are competent in the certain dysfunctions of the physiologicals like renal or hepatic, so certain drugs, they will cause us as toxicity also. So depending upon the patient-related factors, they can also be selected. And along with that, the frequency and the duration of the administration. So this is one of the most important, because the required drug at required time is essential, and also required concentration is very essential to eradicate the infections. So, and also to overcome from the resistance. So inadequate dose may lead to the resistance, or intermediate dose may not cure the infections, and optimal dose should be used for the therapy. And continue the therapy. Acute infections treat 5 to 8 days of the bacterial infections, and except in the cases of the severe infectious disease like tuberculosis, typhoid, and endocarditis, where the therapy will be continued after, so that to overcome from the relapsations. Okay, so and also the selection is also based on the test for the cure. After the therapy, symptoms and the signs may disappear before the pathogen eradicated. So after the treatment or the course will be over, they will be tested again, and they will monitor about the symptoms and signs also. And prophylactic chemotherapy is one of the most important. So that prophylaxis means before occurrence of the any infectious, they will be taken, like any of the major surgery will be undergoing the patient. So they will be prescribed with priorly before the surgery with the certain chemotherapeutic agents. And along with that, we are moving towards the classifications, different classes of the antimicrobial. So there are different classifications are there depending upon their chemical structures, chemical moiety they will be possessing, and also the mechanism of actions, and also the type of organisms of the infection, depending upon that, and spectrum of activity, type of actions, that is whether it is killing the bacteria or viruses or microbials, or it will stop the growth, that is the bacteriostatic, it is the stop the growth, whereas cidal it can kills. And depending upon the source of the antimicrobial agent, where they will be synthesized, or where there will be synthesis of the antimicrobial will takes place. So depending upon the classification can be done. Now towards the first classification, chemical classifications. So depending upon the structural moiety in the antimicrobial agents, like sulfonamides, like dapsone, sulfadazines, and para-amino salicylic acids, and pyrimidine, like trimethoprime, pyrimethamine, and quinolans like nalidic acids, norfloxacin, ciprofloxacins, beta-lactam ring structure in the antimicrobial, that is penicillins and cephalosporins, tetracyclines like tetracyclines, minocyclines or doxycyclines, nitrobenz derivatives like chloramphenicol, or aminoglycosides like streptomycins, gentamicin, amikacins, and neomycins, and microstructure antibiotics like erythromycins, clarithromycin, and azithromycins. Okay. So along with that, lincosamide antibiotics like clindamycins, or glycopeptides antibiotics like vancomycin, polypeptide antibiotics like polymyxin B, bacitracins, and nitrofurantoins like derivatives like furantoin, and nitroimidazole derivatives like for anaerobic, especially the metronidazoles and tenidazoles, nicotinic acid derivatives like isoniazide and ethonamides, and polyiene antibiotics like amphotericin B, nystatin, hamicin, which can be used for the mycosis like agents. Okay, azole derivatives like clotrimazole, ketoconazoles, fluconazoles, posaconazoles, which can also be used for the antifungal agents. Others miscellaneous like rifampicin, ethambutol, grisoflavin. Now, depending upon the type of organisms which are primarily active, so like antibacterials like penicillins, aminoglycosides, erythromycins, antivirals like acyclovir, amantadine, which is one of the natural component of the antimicrobials, which is obtained from the plant derived, and judovidine, and antifungals are grisoflavins, amphotericin B, ketoconazoles, and etc. And antiprotozoals like chloroquine, pyrimethamine, metronidazoles, antihelminthes, so antiworms like mebendazoles, niclosamide, diethyl carbamazepine. So these are the certain drugs which can be depending upon their now coming towards the mechanism of actions of the antimicrobial actions. So certain drugs are there, cell wall synthesis inhibitors like the cycloserins, vancomycin, bacitracins, penicillins, cephalosporins, monobactams, and carbapenems. And also certain drugs are there which can be active antimetabolite, especially the folic acid. So inhibiting the folic acid synthesis. So folic acid is one of the vital for the microbial to produce its purine and pyrimidine, which is one of the component of the DNAs. So inhibiting the folic acid metabolisms like trimethoprim and sulfonamides, so which can inhibit the two enzymes which are involved in folic acid synthesis, dihydrofolate reductase and also tetrahydrofolate reductase enzymes. And in this way, it will inhibit the folic acid. Other than that, the cytoplasmic membrane structure actions, especially the cell wall synthesis inhibitor like polymyxins, and also the certain other like drugs which will be acting over the nucleic acids or DNA, especially the DNA gyrase enzymes like quinolans, like nalidic acid, ciprofloxacin, which will inhibit the DNA gyrase, which is acting like a zip where it will unseal the coiled structure of the double-stranded DNA, and also after the transcriptions, there will be resealing will be taking place by this DNA gyrase and topoisomerism 4 in the microbial. Similarly, the certain RNA elongations inhibiting like mRNA elongations like actinomyosins, and also DNA directed RNA polymerase inhibitions like rifampicin, which is used in the tuberculosis, and also protein synthesis inhibitor, especially the 50S ribosomal component like erythromycins, chloramphenicol, clindamycins, lincomycins, and also the 30S inhibitors of the ribosomal RNAs like tetracyclines, streptomycins, and xantamycins, kanamycins, amikacins. So in this way, along with that, the certain drugs are there, they will inhibit the translation processes, especially the tRNA by the muprocin is one of the drug which can inhibit the binding of the tRNA or the ribosomal unit where the translation process will be taking place. So next, moving towards the spectrum of activity. So depending upon the gram positive and gram negative, if the antimicrobial are specially acting over the specific either of the gram positive or gram negative, they are said to be of narrow spectrum. And in that class, penicillin and streptomycin, erythromycins, which will be either acting over the gram positive or gram negative. And when you're coming to the broader spectrums, where they will be acting both gram positive and gram negative, along with that anaerobies and atypical microbials also. So such drugs, antimicrobial, we can consider to be in the broad spectrums like tetracycline and chloramphenicol. Now moving towards this one, these are the classes of the drugs. So whatever you are seeing the yellowish color, so they are of beta-lactam, especially they will be acting over the gram positive, and some are also acting towards the beta-lactam ring structure of the antimicrobial over the gram positive. So they are, some are narrow and some are broader spectrum in actions, and also the imipenems and meropenems are also there, which is also one of the broader spectrum in actions. Now coming to the greenish-like structures, which will be having the cephalosporins, which are of different generation of the cephalosporins. So they are also acting as a broader spectrum in actions. Even the anaerobies they will be covering, and certain like the fluoroquine antimicrobials like moxifloxacin, which is one of the drug incorporated in the tuberculosis, which will reduce the regimen for the certain days or the certain months also. So levofloxacin. So all these are fluoroquinolines. They are also showing the promising for the broader spectrum of the actions. Now moving towards the tetracyclines like doxycyclines and other. So they are also showing the broader spectrum of the actions. Now coming towards the pinkish color, which is a macrolides like azithromycin, erythromycin, and clindamycins, which are also having a broader spectrum in the actions and also narrow spectrum in action also. So in this way, along with that metronidazole, which is a specific for the anaerobies. So this is how the classifications are also there. And the saffron color, that is the aminoglycosides like gentamicin, tobramycins, they are also having the wider spectrum in actions for the gram positive, gram negative, and their main mechanism is the inhibiting the protein synthesis. Okay, so depending upon this type of actions, how the type of actions, that is the bacteriostatic and also bactericidal. Static means it will inhibit the growth. So like sulfonamides, tetracyclines, chloramphenicol, and cidals, which can kill the microbials like penicillins, aminoglycosides like gentamicin, amikacins, polypeptides and rifampicins, isoniazid, vancomycins, ciprofloxacin, metronidazoles, and cotrimoxazole, that is the combination of trimethoprim and sulfamethoxazole. 1:4 will be there. So sometimes what happens, if the concentration of the bacteriostatic will be increased, they will be acting as a cidal-like actions. Now moving towards the source of the antimicrobial from the fungal like Penicillium notatorum, that is obtained from the soil, fungal, like penicillins and grisoflavins, cephalosporins, and bacteria like polymyxin B and colistins, bacitracins, and actinomycetes like aminoglycosides, macrolides, tetracyclines, polyenes, chloramphenicol. So these are the derivative sources. From there they will be obtained. So only one of the main problem for the antimicrobial is that they are possessing certain toxicity, and also they will possess certain allergic reactions, hypersensitivity reactions like penicillin and other drugs, and they are possessing even the drug resistance also. Certain microbials are very smart. They are changing their target of the antimicrobial, and they are bypassing the synthesis of the metabolites, whatever the previous they are having. So because of that, antimicrobial target will be where is there. So they will becoming an insensitive or resistance will also be takes place. We'll study about that one, and also drug tolerance can be produced. And along with that, certain super infection produced by the antimicrobial, means by the usage of the antimicrobial, another infection it will be leading. So that can also be dealt. So coming towards the toxicity of the antimicrobial, local irritation it will be causing mainly of the gastric irritation or pain at the site, and also it will cause thrombophlebitis also in the veins at the site of injections. Systemic toxicity is also there when there will be high therapeutic index drugs where they will cause us and systemic toxicities like aminoglycosides. It will cause us the renal, CNS toxicity, hepatic toxicity, ototoxicity by the aminoglycosides, and tetracyclines. They will cause us an renal as well as the liver toxicity. And whereas the chloramphenicol, it can cause the bone marrow depressions. So in this way, these are the main systemic toxicity usually the drugs will be possessing. And some other systemic toxicity, especially the INH and antituberculosis, they will also cause a certain hepatic and other toxicity also. Now coming towards the other like vancomycin, it will cause hearing loss, kidney damage, and red band syndrome. Polymyxin, it will cause neurological and renal toxicity. So as I said, these agents, they will cause hypersensitivity reactions, especially the anaphylactic reactions, type 1 of the hypersensitivity reactions, a topic it is said to be. So it will send with the first dose by producing the antibodies. Second time, it will leading into the anaphylactic shock. So penicillin is one of the drugs which cannot be given without the testing of sensitivity testing. Okay, so they will intradermally they will inject, inoculate small quantity of the penicillin over the dermal, and they will make the ring over that. After that, they will view wait for a few hours. If there is any boil or anything, inflammations or redness will be there, then they can say that it is incompatible to the that individual patient. So in this way, they cannot be prescribed. If it is prescribed, then it will be leading into the anaphylactic shock also. Coming towards the one of the most important and need of the our topic, that is the antimicrobial resistance, because India is said to be one of the contributor for the superbug because of the lot of usage of the irrational usage of or empirical usage of the antimicrobial agents. Okay, so resistance antimicrobial is nothing but an unresponsiveness of the microbial towards the antimicrobial agents, and it is similar to the drug tolerance also. So there are two type of resistance, natural and the acquired. Okay, natural, usually antimicrobial, they are very when they are previously sensitive, they will becoming an insensitive because of their usage. So they will possess natural resistance. They will changes the binding domain site, and they will leading into the natural resistance. Acquired, that is the where the development of resistance by the microbial will takes place by the usage of antimicrobial for the longer period of the durations, like the staphylococci tuberculosum develop the resistance to the penicillin because of the usage for the 50 years. Even the gonococci develop the resistance to the sulfonamides in the 30 years. So this is what they wild. So they will be change their genomes, or they will be causing a mutations. So that is what happens in the during the development of the resistance. So mainly developed by the mutations, that is the point mutation or single mutation or multiple mutations in the gene, or gene transfer is also takes place. So coming towards the mutations, that is where the heritable genetic changes that will be occur in the microbials, where the drug will be bounded. So usually the plasmid or vectors, they will cause us all these changes in the gene transfer from one organism to the another. Okay. Mutation, it is mainly due to the single mutations or multiple mutations will be there over the genomes. So depending upon that, the sensitivity will be decreased towards that particular antimicrobial, which was mainly previously they are susceptible, now later becoming an insusceptible also. So this is what the mechanisms, development of the resistance. What are the mechanisms? So gene transfer will takes place from the one organism to the another organism. That is the resistance factor, which is having one organism, it will be transferred to the another organism by these three methods, that is through the conjugations or transductions or transformation processes. So mainly of the conjugations through the transponin donors, and where the nuclear component will be transferred from one gene to the another, or through the plasmid also crossover will take place, and the genomes of the resistant factor will be transformed from one microbial to the another. So this is what they about the conjugations, where the cell to cell contact, where the transfer of the chromosomal or extra chromosomal containing component from one bacteria to the another through the sex pili, and where there will be carrying of these genes, where it will be consisting the resistant factors or resistance transfer factors. So one organism to the another organism, it will take place. So in the tiling. So this usually it will take place in the gram-negative bacilli. Okay, even in the non-pathogenic organism, which will be having in their extra chromosomal or like a plasmid, or in the bacterial virus vectors, where it will be transferring that R factor to the pathogens also. So in this way, the conjugations through which the resistance will be produced. So some of the examples are like chloramphenicol resistance to the typhoid bacilli, penicillin resistance to the Haemophilus or even the gonococcals, and streptomycins resistance to the E. coli. Another mode of the resistance, it will be developed in the microbials through the transductions. So here the transfer of the gene through the bacteriophage or through the vectors to the one bacteria to the another bacteria of the same species, where there will be transfer will take place through the bacteriophage or through the extra chromosomal component in their bacteria. So transmission of the resistance between the strains of the staphylococci and between the strains of streptococci is also takes place through the transduction pathways. Now moving towards the another mechanism through which the antimicrobial resistance will be developed. It will be occurring in the natural conditions, where they in the certain medias where the so many microbials will be there. So one of the microbial which is having the R factor or the naked DNA from its, it will be transferred in the environment, and it will be incorporated into the genomes of the another microbials. So such process leading to the crossover mechanism will take place, because it will, the R factor which will be there in the media, it will be transferred to the another bacteria where it will be residing. So that kind of the genome transformation will take place. So such kind of the transformation later there will be incorporation in the genomes of the microbials. So in this way they will develop the resistance. So after this, there is also one of the drug tolerance is also one of the factors which will be causing an inefficiency of the antimicrobial. Loss of affinity towards the target biomolecules, like the penicillins, which are binding towards the protein binding proteins or penicillin binding proteins, they are said to be. So if they are will becoming an resistance or insensitive because of the changes in the that binding domain site. So because of that configurational changes in the protein binding sites, so the affinity towards that penicillin will be lost. So in this way, the drug tolerance can be developed. So this is the another important aspect when we are dealing with the antimicrobial superinfection or supra-infections. So usually it will take place when we are using the antimicrobials. One of the example is that when we are taking the antibiotics, some of the good bacteria in the intestines, what we call as a floras, microbial floras, which are there, which are involved in the vitamin synthesis, and they are also be killed. Because of that, what happens, certain diarrhea and other things will be developed, and also malnutrition of this certain vitamin is also one of the component. So that kind of that is antibiotic induced infection, it will call that. So in this way we are calling as a super infection or supra infections. So super infections, they will be development of is associated mainly of the broad spectrum or extended spectrum of the antimicrobial, such as the tetracycline, chloramphenicol, or ampicillin, or new cephalosporin generations. So they will develop the super infections will be there, and the host defense mechanism will be compromised. Then there will be likelihood of super infections are usually happens. So bacterial super infections in the viral respiratory diseases are there by the usage of the antimicrobial, and infectious of the chronic hepatitis carries with the hepatitis D viruses, and piperacillin tazobactams may also cause super infections like the Candida albanica. So these are the certain super infections caused by the microbial because of the usage of the antimicrobials. So how to overcome, how to manage these kind of the super infections? Treatment for the super infections like Candida albanica. So it is one of the fungal component, and it can be treated with antifungal like nystatin and clotrimoxazole. And certain resistance of the staphylococci will be treated with the cloxacillins. And pseudomonas, where there are UTI infections, treatment with the carbacillins or piperacillins, or with the gentamicins. And super infections can be minimized by the usage of the specific narrow spectrum, starting with the narrow spectrum, and after that we have to move to, if there is any relapsation in the infection, or then we can go for the broader spectrums. Avoid antimicrobial to treat self-limiting or untreatable viral infections also. So usually for flu and other things, they are the viral component, but we are taking the antibiotics. So that will not hold good. That will leading into the super infection also. Avoid prolonged antimicrobial therapy also. So that is also leading to the super infections. So these are the references of my presentations. After completion of this chapter, you have learned about what is the chemotherapeutic agent, how of the chemotherapeutic agents were started, and what are their different classes of the chemotherapeutic agents, and what are their clinical usage. And along with that, we have studied about the antimicrobial resistance, their mechanism, and along with that, for infections which will be caused by the antimicrobial. Thank you.